And I say to the mayor, it's not too late. It is not too late to listen to the voice of the people.
They came by the busload and later by air. New arriving migrants grew from hundreds to more than 50,000 in 2 years.
I not feel safe. We don't feel safe in our houses.
Prompting pushback with an undercurrent of tension.
You all have taken up our resources.
A sanctuary city shouldering an unprecedented crisis.
This is the time for Chicago to shine.
Millions of dollars poured into opening new shelters and providing care.
We picking and choosing who we take care of.
As we press for answers on why millions of public dollars meant for a crisis flowed to private industry.
We have given an accurate account of how dollars have been spent.
That's it? Is there anything that would preclude your administration from sharing that level of detail?
There's no information that has been kept from you.
Thanks so much for joining us. I'm investigative reporter Bennett Haverly. For nearly 2 years, we've reported on Chicago's unprecedented migrant crisis. 51,000 people bused or flown here, many at the direction of Texas Governor Greg Abbott. Once they arrived, the city placed them into police stations and later shelters at a cost that ballooned to more than $500 million. In following the money, we uncovered a lack of transparency in how those public dollars are being spent and how migrants were treated. So we'll start there with a look back at our reporting on shelter conditions and the death of a 5-year-old child.
En la 2241 house.
This migrant woman once lived at the city's most crowded shelter on South Halsted. She asked not to be identified out of fear of reprisal.
Mira, te voy a contar mi situación.
When her son got sick with a fever in October, she says, the people in charge told her to let them know when he is really sick, and they'd call an ambulance. But she'd need $1,000. It was money she didn't have. While grateful to the city for the shelter, her family left after witnessing the December death of 5-year-old Jean Carlos Martinez Rivero. The Cook County medical examiner revealed that Jean Carlos died from a blood infection known as sepsis due to strep. COVID and 2 other viral infections were listed as contributing factors. Records show he had a history of recent fevers and had taken over-the-counter medication, but there's no mention that Jean Carlos saw a doctor in the days before having a seizure and being found unresponsive at the shelter. These newly obtained documents show evidence of strep was found in the boy's blood, liver, and spleen, indicating a widespread bacterial infection.
I don't know of anyone who's been working with this population that has felt like we have done a great job, particularly with regard to screening and medical care.
Volunteers like Annie Gomberg have been critical of the city's response.
In my estimation, there's always been a gap. The need has always dwarfed the effort, and there has always been insufficient coordination.
NBC5 Investigates found that Jean Carlos was one of hundreds of migrants last fall who sought emergency medical care. Through a series of Freedom of Information Act requests, we examined thousands of city records that found as far back as October, the city was aware that overcrowding shelters could put both migrants and the staff at higher risk of contagious illnesses. Those same records also note that a lack of space within the shelter system created challenges with placing people and getting them their initial health care.
From late October to January, as the city worked to clear police stations, shelters like Halsted ballooned from 1,000 to more than 2,500 people. For the month of November alone, records NBC5 Investigates obtained show there were at least 272 medical runs to shelters and police districts. 86 involved children. At least 27 of the runs mentioned a patient with a fever. While medical providers were placed at shelters, city records show they were only on site 1 to 2 times a week. Migrants we spoke to outside the Halsted shelter said that created a bottleneck of patients not being seen. They told me since the boy's death, responses to their medical needs have improved, but they're still getting bills, like this one for $1,600 from Cook County Health. The woman who shared it with me said she has no means to pay it. We questioned Mayor Johnson about our findings.
Knowing all that, could your office have done a better job of addressing the health needs of migrants?
Well, first of all, I've expressed my condolences and my deep sorrow for the loss of this baby boy. You know, as far as, the health care that we have provided along with the county, of course we've had our challenges. That was never a secret. People were arriving in the city of Chicago in a very extreme It just wasn't right the way people were arriving here, and we were responding to it to the best of our ability.
It's hard for me to think that professionals, that people who work in this field, that work in the field of public health, that work in medicine, would say that this is the best of our ability.
By February, the city knew it was spending $1.5 million per day, and that sheltering close to 15,000 people was unsustainable, especially without additional federal money. As a result, the city instituted a 60-day stay limit and began evicting people. At the same time, we were still demanding answers on where all the money was going.
We have given an accurate account of how dollars have been spent.
That's it? Is there anything that would preclude your administration from sharing that level of detail?
There's no information that has been kept from you.
More on that when we return. Watching Cost of a Crisis. By March of this past year, the city announced it would begin evicting migrants from shelters. City aldermen argued to push back against that deadline amid the cold weather. As we press Chicago Mayor Brandon Johnson for answers.
Mayor Brandon Johnson.
Mayor Brandon Johnson on stage in early March.
Every single young person, I want you to apply today.
To promote a summer jobs program, initially sidestepped questions about if the city would once again postpone the impending deadline for migrants to leave the shelters.
The city has twice or three times pushed the deadline back. Are you prepared to do that again?
We're compassionate people. I got you.
I'm just trying to get an answer now.
Oh, don't say that to him.
No, it's okay, but is it okay if I say that we are compassionate people, though? Do I have your permission to say that?
Mayor, it does. It just doesn't answer the question.
But so it's not okay that I let people know that Chicago's compassionate? Let me just say it, though, okay? Thank you. We are compassionate people, and so we're doing everything in our power to demonstrate compassion. Now, as far as whether or not we will extend deadlines, we haven't gotten to that point.
The mayor's spokesman later confirmed that the first wave of migrants will be asked to leave starting on March 16th. Those reaching their 60-day limit will have the opportunity to re-enter the shelter system. But Johnson told reporters the city's main goal is to resettle as many people as possible. Are you guys seeing the demand for this ramp up as we approach this deadline?
Yeah, absolutely.
Charlotte Long works with the Sanctuary Working Group, a grassroots organization helping a small number of migrant families find housing, and with the help of grant funding, is paying their rent. The resources are finite. Charlotte says finding landlords willing to take on migrants who are eager to work but have no steady income is challenging. Do you worry that people will end up on the street?
Absolutely, absolutely. You already see the amount of migrants I see selling candy has tripled in the last few months. Children selling candy, because literally the family doesn't have any other option.
This family we met outside Union Station told NBC5 Investigates they were flown here from Texas months ago. They don't have work permits and are currently renting a room for $600 a month.
I see their faces when I'm sleeping. I think about their names all the time. If I'm driving around the neighborhood and I see a for rent sign, I call it immediately because I can't stop thinking about housing and shelter. I can't stop thinking about where are they going to stay.
According to the city, as of late January, roughly 1,000 migrants had obtained work permits. Of the 14,000 that were in shelter at the peak of winter, only 7,500 were eligible for state-funded rental assistance. Charlotte's worry is that as the migrant population decreases in city shelters, another one could increase: the number of Chicago's homeless. By June, as media attention waned on Chicago's migrant crisis, we kept digging, discovering a lawsuit filed against a developer that helped uncover more costs the city was keeping secret. Consider these numbers. More than 6,000 people still live in city-run migrant shelters. That means costs are still adding up. Since August of 2022, the city of Chicago has spent more than $400 million, according to the city's spending website. Nearly $253 million went to one private company, Kansas-based Favorite Healthcare Staffing, which staffs the shelters. Another $76 million went to Equitable Social Solutions. That company partnered with another called ReloShare, which helped identify and sign lease agreements with property owners of the buildings that eventually became the migrant shelters.
That's where a number of those leases are.
But when we asked the city months ago for copies of these lease agreements, we were given just 9 out of 27. The use of these private companies has helped mask from public view where the public dollars have flowed. What we didn't know until now is how much the property owners of the migrant shelters were earning. But thanks to a new lawsuit, we're being provided some more clarity. A lending company filed this lawsuit in May against 2 Chicago developers, alleging they did not make it clear when they signed a loan agreement that the building in the West Loop would be used to house migrants. What is not in dispute is that the owners of the Ogden shelter are paid $150,000 a month by ReloShare as part of a use agreement. That means in a year's time, they'd receive more than $1.8 million. The lease agreement also calls for additional payments of up to $400,000 if the number of migrants inside the Ogden shelter exceeds 650. The latest figures show more than 700 people still live here. If there are public dollars involved, shouldn't the public know where they flow?
100%.
Back in March, Alderman Andre Vasquez, the chair of the City Council's Migrant Committee, told us aldermen themselves have had a hard time accounting for all the spending.
I guess that's still the question that's outstanding.
When we attempted to ask Mayor Brandon Johnson about this at the time, he said this.
Again, we're meeting you right where you are.
Were it not for this new lawsuit, the public would have no idea how much these property owners are earning.
All right, good afternoon, everyone.
When we pressed the mayor about this at the time and asked if he would consider adding the information to the city's website, he said this.
We have given an accurate account of how dollars have been spent.
That's it? Is there anything that would preclude your administration from sharing that level of detail?
There's no information that has been kept from you.
Johnson then reiterated talking points he's made before, how he's renegotiated contracts to save taxpayer money, and how Congress has failed to provide additional financial relief. He also doubled down, incorrectly stating that all spending information is available.
That information is available to you, sir.
Not all of it, though, is, sir. I mean, that's the point.
Can you give me a specific example of what's not available?
The Ogden shelter in the West Loop, that's what that's spelled out in this lawsuit, that they get $150,000 just for being the property owner per month. Nowhere is that available on the city's spending website. My question, again, is simply, is there anything that would preclude you from including that level of detail? You guys have said you're transparent. Why not show it?
All of the information related to the spending to this mission is available.
NBC5 Investigates reporting on the cost of the city's migrant crisis uncovered a landscape where private companies and developers raked in millions while migrants faced an uncertain future. The population inside Chicago's migrant shelters has been shrinking for months. At the same time, the city's facing a projected billion-dollar budget shortfall. Days out before revealing his spending plan, Mayor Brandon Johnson announced the city's migrant mission will effectively stop at the end of the year. Are we announcing this today because the city is in such a financial hole that in order to go forward and sort of, I guess, lessen that blow, you've got to announce this and hopefully inherit some cost savings?
We're announcing it today because it's the right thing to do. It's the right thing to do. Now we'll get to the financial ramifications to it, but I just want the people of Chicago to know that we stand up for our values.
Under the One System initiative announced by Johnson, migrant shelters will close by December 31st. Both migrants and other homeless Chicagoans needing housing will have to compete for bed space, 6,800 beds, far fewer than the 15,000 once available in the migrant mission. The city's landing zone will also close in the coming months, the mayor acknowledging when pressed that money is a factor.
The harsh reality is that we can do what we can afford. We've been stretched to the limits.
In September, NBC5 Investigates was first to report how Mayor Brandon Johnson signed a $100 million contract extension for Favorite Healthcare Staffing, the Kansas-based company that staffs most of the city's shelters. How do we do that amid this budget crisis? When pressed, Johnson sidestepped her question.
So we've saved the taxpayers over $200 million.
His staff later issued a statement saying the company is owed back pay, which has received more than $308 million so far. This past winter, the Johnson administration had to address allegations of overcrowding and inadequate medical care after a 5-year-old boy staying in a city shelter died from sepsis caused by strep.
They're showing up sick. Do you hear me? They're showing up sick.
Following that tragedy, and our reporting that showed the city was aware that overcrowding posed a health risk to migrants and shelter staff, the city soon instituted a 60-day stay policy, a plan meant to incentivize migrants to leave the shelter system and resettle elsewhere. Fast forward to now, 10 months later, and a new plan to shutter the system as we know it. A promise from Texas Governor Greg Abbott to send additional busloads of migrants never materialized. But challenges remain here.
Hello, friend. I'm from Venezuela. Chocolate.
It's not uncommon to see migrants asking for money or selling candy on Chicago street corners. This woman told me, when we arrived here, we thought we'd have a job. It's not easy to find work, and we still do not have a work permit. A similar story from this man, who asked not to have his face shown. He panhandles for money and food for his son and wife. Even though the city is closing shelters, there are still migrants who are making their way back to the landing zone and attempting to re-enter the shelter system. It's a pattern that began this spring when the city started evicting people. Of the more than 2,700 people who left the shelter system earlier this year, more than 2,000 have returned. We met this man at the landing zone in late October. He could be among the last to be reassigned. He told me it's challenging not having a work permit, and that's why migrants have suffered a bit. He told me sometimes I'm ready to throw in the towel and return to my home country.
When we come back, as shelter operations wind down, the level of uncertainty and uneasiness increases.
We have women with children, women with infants arriving who are being turned away saying there are no shelter beds. Where are they supposed to go? What are they supposed to do? Nobody knows. Nobody has an answer.
As we close out the year, we report on two major changes. The first, the city's decision to end the migrant shelter operation leaves more questions about housing insecurity and where the new arrivals will go. The second, a larger looming question about if they'll stay, amid campaign promises from President-elect Trump that his administration will soon begin a massive deportation operation.
At this food pantry on Chicago's South Side, there's a chill in the air and a feeling of uneasiness.
Entonces, la verdad, sí.
Iris Salinas is from Honduras. She told me she worries about money and finding work. She's been here a year, has 2 children with kidney disease. They moved out of a city-run migrant shelter and are now in an apartment. She's grateful, but doesn't know what the future holds. Of the more than 4,000 people who were forced to leave the city-run migrant shelters due to a 60-day stay policy, roughly 2,900 of them returned here to the landing zone and re-entered the shelter system. Chicago has spent more than $500 million providing shelter to migrants, and now facing a financial crisis, plans to close the landing zone at the end of the year and fold migrants into an umbrella system where they'll compete for beds with other Chicagoans experiencing homelessness. The umbrella system provides 6,800 beds, which is still 4,000 short of what the city previously said it would need.
2, 1.
At a recent ribbon-cutting ceremony for a new homeless shelter, I pressed Mayor Johnson for answers. Are you at all concerned that the city's One Shelter initiative may fall short, that you may end up with people out on the street come winter?
So we're not getting out of the business of housing people. I mean, we're at a ribbon cutting today, which is the business of housing people. And congratulations to this community for putting their arms around the people of Chicago. And this is something that's very important. Thank you for this question. Our city, a year ago, we were under attack by the governor of Texas, right? I mean, you all covered this, sending busloads of people without any support from the federal government.
Not hearing an answer to my original question, I pressed again. I appreciate the context, Mayor. My question, though, was, are you concerned that we are still bed space short, thousands of beds short?
I thought I'd answer that when I talked about, for the first time in the history of Chicago, we have actually shown it for the people of Chicago. Do we need to do more? I mean, I think you know the answer to that.
Back at the food pantry, Iris tells me she's also concerned about what a new Trump administration could mean.
Según estoy escuchando que pues van a hacer.
She said she's heard there are going to be different laws and regulations. Our conversation came during the same week that President Trump's border czar, Tom Homan, visited Chicago to attend a GOP gathering.
Chicago's in trouble because your mayor sucks and your governor sucks.
Homan told the crowd that he's willing to work with Mayor Brandon Johnson and Governor Pritzker as long as they don't impede President-elect Trump's mass deportation plans, which he says will target criminals but could also include others. While Governor Pritzker said he did not think undocumented immigrants with violent convictions should be in the U.S., he did say he has an obligation under Illinois law to defend and protect migrants. Mayor Johnson made similar remarks.
Going after undocumented people, it's a threat to our civility and to our democracy. I think it's a waste of effort and power.
I want to be clear. If you're in the country legally, you're not off the table.
It's hard to know what's going to happen, but the uncertainty of it all is what's most terrifying.
All of it. The unknown is unnerving for volunteers like Veronica Roman Saldana, who runs the Pilsen Food Pantry, where so many migrants of the past year have sought help.
Why is it so emotional for volunteers like you?
Because we've spent so much time. We've built relationships with a lot of folks, especially, I think, those of us who were helping in different ways at the police stations and, shelters and things. We spent a lot of time and energy and really got close to a lot of people.
Volunteers like Veronica worry that the cost of the crisis could continue for both the people directly impacted and the city, and that $600 million could have been spent all for naught if it ends with mass deportations. Thank you so much for watching. I'm Bennett Haberly. NBC5 investigates.